The United Kingdom is the first European state to record more than 100,000 deaths linked to the pandemic. And according to the University of Oxford, the UK has one of the highest COVID death rates anywhere in the world. Prime Minister Boris Johnson, whose handling of the pandemic has been heavily criticised in some quarters, said he was deeply sorry for every life lost and that he took full responsibility for everything that the government has done. Professor Chris Whitty, the UK's chief medical advisor, said there would be many more deaths in the coming weeks before the rates would start to fall. As the UK passes this particular milestone, our health correspondent Catherine Burns talks to some of the families who've lost loved ones during the pandemic.
Something really precious has been taken away from me and it's really hard.
This is a life that's gone and the impact is huge.
I'm left now with a young family who've got no dad.
My life is destroyed. Everything is gone.
Today we're using candles to represent those who died. One light for every life lost. It started on March the 2nd, the first person to die within 28 days of testing positive for coronavirus. The next day, there were 2 more deaths. In less than 3 weeks, the official death toll was over 450.
You must stay at home.
The Prime Minister announced a national lockdown on March the 23rd. The next day, the official death toll reached 1,000. Richard Nabew died on April the 10th. He was a nurse who worked with elderly people. His daughter Jamie hated not being able to visit him in hospital.
I called him the morning of the day he passed away and he waved and he said, "Bye, Jamie." And I said, "Bye, Daddy. Speak to you later. I'll call you in the evening." And the evening never came. I never thought he wouldn't come home. Something that I've struggled with is the fact that he was alone, but I find comfort in the fact that every day he knew how loved he was. Yeah. It was the disbelief that this person, my favourite person in the whole world, wasn't here anymore. You haven't had the opportunity to grieve because it feels like the whole world is grieving.
By the time Richard died, the death toll was more than 13,000. But the first wave had peaked. The number of people dying every day began to fall, slowly and gradually. By the start of June, more than 38,000 people had died. In reality, the death toll would have been higher. In the early stages of the pandemic, the figures only included people who tested positive in hospital.
Brilliant job.
Ada Jackson was 90 and had early signs of dementia. But families say she was happy, strong and feisty until COVID came into the care home where she lived.
It started to go from 1 person to 3 people to 5 people. You then started to just think, my goodness, they're not going to be able to stop this. They had the residents locked in their room. I felt helpless, that solitary confinement in the room. I wonder if Ada felt abandoned at that point in time.
Ada died on June the 3rd. She hadn't seen her family since March.
These are human beings. These are people with families. They have lives. They're not just numbers. This is a life that's gone, and the impact is huge.
As summer continued, there was some semblance of normality. Packed beaches, foreign holidays, people were encouraged to eat out, to help out. Every single day, though, there were COVID deaths. The numbers were much lower. On September the 1st, 3 people died. But once again, that number started to climb. There were over 700 deaths in September and more than 5,000 in October. Across the UK, there were new restrictions, but the death rate stayed stubbornly high in November, often with more than 400 people dying a day. Dean Matthews was 42 years old. His wife says he was a big kid who lived for his family. Even when he had to call out an ambulance, she thought he'd be okay.
Just said, "See you later." I didn't hug him, I didn't kiss him, just expecting a couple of days in hospital.
I sent him a selfie and then he said, "There she is, my gorgeous girl." And I think that was the last time I really spoke to him. That was it really, wasn't it?
Dean died within 18 days of getting a tickly cough. He had 5 children. The youngest is just 7.
He keeps saying, like, "Mum, my head can't understand, like, why he's not coming back," sort of thing. We're still at the point where we kind of struggle to think, like, why Dean?
Around a month before Christmas, we were told that we'd be able to have festive bubbles, but the increase in deaths was still speeding up. By December the 12th, COVID had claimed more than 65,000 lives.
Mum, happy birthday to you.
Including 50-year-old Midula Sarwar. She and her husband both caught COVID at the same time.
The day that Mum went into the ICU, so the day that Mum went on a ventilator, Dad was also admitted.
So my wife is there in the same building, in another floor, and she was just fighting for her life.
And you think of all the things. I'm okay. You think of all the things that you're gonna miss.
Sarwar recovered, but his wife was critically ill for weeks.
I had a diary of every day morning and afternoon. Everything is just written here.
Including the day medics said Sarwar, Rashik and his 14-year-old brother could come and say goodbye.
Doctor was very sorry to say that the time has now come to an end. That was the last time I saw her. And she was so beautiful. She was so pretty. She was so beautiful, the way she was looking when she came to my life 31 years back. So that's the most precious memory I have.
By New Year's Eve, the death toll had reached 76,000. Now it's taken just a few more weeks to get to 100,000. And this is not over yet.
It's a loss that should never have happened. It should never have gotten to that scale.
It's not just 100,000 people, it's 100,000 people whose families are going to miss them for the rest of their lives.
The echoing voices of just a few of the families grieving for loved ones since the pandemic struck in March of last year. Well, as I mentioned earlier, the Prime Minister says that he is deeply sorry for every life that has been lost and takes full responsibility for everything the government has done. Speaking in Downing Street today, he said the government had done everything it could to minimise the loss of life. Our political editor Laura Kuenssberg has more on the response.
A strange and frightening drumbeat first emerged.
There have now been 4 deaths from coronavirus in the UK.
Then a horrible and familiar rhythm.
759 have
5,300. 16,006.
39,728 have now died.
The soundtrack of a crisis, nearly a year in the making. A terrible crescendo towards today.
I'm sorry to have to tell you that today the number of deaths recorded from COVID in the UK has surpassed 100,000. And it's hard to compute the sorrow contained in that grim statistic.
Around a third of those who've fallen victim to the disease are among the most vulnerable, the most elderly, in care homes cut off from the outside. Twice patients came into Thai Yilmaz homes with COVID without a test, bringing the worst.
This thing came in mercilessly.
7 residents died in a week.
These people aren't numbers, they're family, they're people that we look after, we care for. I'm sorry, I get emotional about it, but it's just devastating.
What's it been like for you personally?
Stopping's not an option, is it? I mean, we're dealing with people's lives here. You do whatever it takes. You don't stop.
And the cost of the close down to try to slow the spread of the disease has broken all the wrong records. Anna in Essex was first one of millions put on furlough, then redundant, now on the search for a job, sometimes competing with 200 others.
It was frightening. I went from sort of hero to zero overnight. This time last year, we might have been sitting planning where we were going to go on holiday. Now I'm worried about putting the heating on. It's real worrying times.
The pandemic's absorbed almost all the government's time and focus. But whether on adequate equipment, testing or lockdown itself, ministers have been accused again and again of being too slow at the start.
There's a strong sense, I think, that our government has been behind the curve at every stage, that there's been, if you like, a reluctance to take tough decisions when they needed to be taken.
No government's ever grappled with a problem quite like this, but hoping for the best, the country's experiences are near the worst. Prime Minister, near the start, the hope in government was to contain the numbers to 20,000. It's now 5 times that. What went so wrong?
I am deeply sorry for every life that has been lost, and of course, as Prime Minister, I take full responsibility for everything that the government has done. What I can tell you is that we truly did everything we could and continue to do everything that we can to minimise loss of life and to minimise suffering in what has been a very, very difficult stage and a very, very difficult crisis for our country.
The appearances in Downing Street, the announcements of the daily toll, may feel like a terrible routine. But right now, in these dark days, how the government's run and how we live is hardly normal. Not normal at all. Laura Kuenssberg, BBC News, Westminster.
Well, since the beginning of the pandemic, almost 250,000 people in the UK have been admitted to hospital with COVID. More than 37,000 are in hospital at the moment. The Chief Medical Officer for England, Professor Chris Whitty, has warned that the death toll and the pressure on hospitals will remain high for some weeks before the effects of the vaccine begin to be felt. Our health editor Hugh Pym visited King's Mill Hospital in Mansfield to meet some of the staff and patients there.
Every day in intensive care is a daunting challenge for staff as they strive to keep patients alive.
Some of the shifts that I have had are the toughest that I've ever had. In particular, one night shift that I had last week was one of the worst shifts I've ever had in 21 years of nursing.
From experience, I can tell you that I'm seeing more sicker patients this time than I saw in the first wave.
Doctors are trained to deal with death, but nothing like this. Umar has had to cope with the savage impact of COVID, both in his job and at home.
My parents have got COVID. My mother-in-law is in the ICU at the moment. I've just lost some very dear family relatives of COVID. So when you see these patients in the hospital, it just gives you that flashback as well. But you've got to shut that down and you've got to continue looking after your patients as the best as you can.
It's just so sad, you know, because for every person that dies, we know there's a family that's not been able to do the normal things that they would do for that loved one who's died.
Edith is a hospital chaplain. She has to face up to grief most days, comforting the dying and their families, but also supporting staff who feel the losses intensely.
Whenever you've got lots of people dying on the ward, you know, it comes at a huge cost to the staff as well as to the families.
Gary has been a hospital porter for 27 years.
It is emotionally draining. We move poorly people, and then we had to move deceased people.
Diane is a cleaner. She's on the COVID frontline as much as anyone.
I think if you could see the light at the end of the tunnel and somebody to say, you know, it's going to turn off, then that would be brilliant. But we're soldiering on and we're trying our very, very best to work as hard as we possibly can.
How do you feel personally sometimes?
Me? Upset. I go home sometimes and I could just sit and cry, and it's just because it's such a, you know, it's demanding at the moment.
There have been more than 400 COVID deaths at the hospital, but here and across the NHS, prospects for patients are improving.
The medication and the care has changed dramatically over the last year, and whilst the volume of people being diagnosed with COVID is higher than it was, we're seeing fewer patients dying and fewer patients going intensive care.
People need to know it is not a game. It is frightening.
Barbara lived with cancer before it went into retreat.
What I mean, they're brilliant, lovely nurses.
Then she was struck by COVID. She was keen to get this message across.
Just wear your mask and wash your hands. That's all it is, isn't it? That's all they've got to do.
Barbara died yesterday. Her family wanted us to use her interview to warn of the serious consequences of COVID.
Yes, our thanks to Mrs. Roberts' family for allowing us to include her in tonight's report.